We want to thank you for taking the time to join us today for an overview and an update of Triada. We have some exciting things to share with you, whether you're new to Triada or if you've already played an important role in our work. I know we have people joining us from all over the country, from Texas and Florida to the Northeast and Midwest as well. So my name is Carol Reichart, and I'll be moderating today's town hall. I became involved in Triada through an invitation from Dr. McNeil. We've gotten to know each other over the last, Michael, 10, 12 years. Started with our aronia berry operation, and then he also has helped our family farm and our farm tenant in northern Iowa convert a 200-acre conventional commodity farm to fully organic. This year will be our fourth full organic crop. Michael did an amazing job working with our farm tenant and explaining how he would be with him along the way, teaching him his methods and supporting him in pivoting to something that he didn't know. He won him over, and he's still totally excited, and it's being rewarded both economically for him and for us and for the ecosystem too. Michael also knows that I'm really passionate about improving the health of our natural resources and improving the health of our citizens. We know that this isn't just a public health issue because it's very personal to each of us and to those we care about. And each of us have our own reasons to care about improving both chronic illness as well as more acute diseases like cancer. Living in Iowa, we are well aware of the health trends that are out there. Iowa, for example, has the second highest cancer rates of any state in the nation, and the only state that still is increasing. The other disturbing trend is that it's younger and younger people. I lost my incredible 26-year-old nephew after a valiant 3-year battle with non-Hodgkin's lymphoma, and he just had the most incredible smile, and I see it every day. And it's one of those things that keeps me motivated to want to learn more and do more. And I know we all have stories like that. So when Michael asked me and presented me with the opportunity to be involved with Triada, it was a no-brainer. One of the other things, I guess, that came out of COVID was Triada. Carla and her nutritional cohorts and academic cohorts decided to use their time and their energy to improve the human health condition. So they set out on this audacious mission, and they looked for experts to help join their efforts. Because healthy people need healthy, clean food, they were advised that they needed to add an agronomist to their team. Through research and connections, they found Dr. Michael McNeil, an agronomist and ag advisor from Algona, Iowa. Not just an agronomist, Michael also has a PhD in quantitative genetics and has a long list of other degrees and work experiences that made him just such a perfect fit for this new initiative. And I'm so excited for you guys to be able to hear from both of them, Carla as the founder and Michael as the chairman of the board, to discuss the programs and some of the initiatives and some of the exciting new information that's coming out of the work that they're doing. We are a science-driven, not-for-profit, advancing regenerative organic farming, nutritious eating to elevate health. And through the core values and principles of farm well, eat well, be well, we promote practices that support lifestyles to foster vibrant and healthy people and healthy communities. Triada is crossing into different disciplines and having those conversations to try and uncover the mysteries that are underlying these health trends that we have. So Carla, do you want to talk a little bit about the signature programs and Pearl in particular?
Sure. Thank you all for being here. So we led with science of personalized nutrition, education, and incorporating real food. Our audience and the people that we served in this project were children living with autism, 9 to 30-year-olds. And our industry partners, lab and diagnostic companies, sponsored our work to be able to evaluate underlying cause. The value of that to date is over $1 million of in-kind support. Our team volunteered clinically, and so did the doctors. We got the lab and diagnostics handled. We now have a global expert panel of leaders with science as our driver, including academic institutions. We're in the process of analyzing and reporting data and publishing, and the data is driving our next steps. That's what we're up to. We gave you an example of one of the posters. Posters in the academic sector are included at scientific meetings, and we've done a lot of them. We're probably up to 8. What it's done for us is to bring the team even further closer together. We're evaluating data at different time points and then going out and sharing with our industry and academic partners in conversation, learning. The next steps are to look at publishing in academic journals, from agronomy to human nutrition, and that's our signature. We're looking at marrying those 3. Here's some of the results that we have so far, simply stated. Even though our sample size, the number of people that we have evaluated is small, it was a beginning study. We are showing that 95% have a mold toxin exposure of ochratoxin A. It's dangerous and it has implications to health. 100% has a presentation of genetically expressing an inability to detoxify and get these toxins out. The toxic load genetically and in actuality was impacting every one of the participants, with 97% impacting our body's immune defense system so far. What does this all mean and what do we do about it? We studied this for 12 weeks, and basically our treatment plan was eat well, eat clean, drink clean. We did not do dumb diet. I'm sorry for that. There's a lot out there. I come from an Italian family, and if I go in and talk about what not to do, people stop listening and they change the locks on the doors. They're just like, we don't want to hear it. We want to be able to include food and lifestyle in a way that we can do something about it. So that was our approach. What you can do is eat clean, drink clean. We introduce them to strategic ways of nourishing their body. And the good news is from 0 to 12, things started to change. Food matters. Our genes, our environment, and diet work together, and we're on a mission to demonstrate that and to demonstrate it in a way that people can handle it. So these are all of our industry and academic partners, and they really came to the table to help us out so that we could get started. Now our game plan is to continue to fundraise and to further develop and to collaborate so that we could get it moved to a new and a higher level. We're up to braiding from farm, from the soil health to the growing of food, to the sourcing of food, to the table. And from the very start is not only better together, but stronger together. So farming, food, and health uniting as one force, and then creating a pathway that heals people and contributing to the health of the planet. We're on home soil right now, and we're very focused on American health. These are all of the humans, right, that have agreed to interact with us with their scientific knowledge, with their sweat equity, with their intelligence. And so far we're up to 34. And there's a lot of MD, PhDs, and really smart people. What we're really the most proud about is that the ego is at the door and we're learning from each other and we're not competing with each other. And we think that in that way, that's going to be how we continue to proceed and complement each other.
And Carla, I would just say on that too, is that to me, that is just astounding. The team and the individuals that have been at the table and spent the number of hours and the dedication, it's remarkable. And I want to, if some of you are on the line, I want to thank all of you for being there. It takes a systems approach, it takes a collaborative approach, and it's not going to get done any other way. And that's just such a great illustration of that's a lot of people. So, and organizations too on the one before. So I just want to thank everyone.
Dr. Stein's on the line right now, and I'm not sure if I want to give him just an opportunity to make some statements because he's been a strong advocate and he's with us and he's staying with us, and his leadership and his infusion of science and from a medical standpoint and from a lab diagnostic has been really helpful to us.
First of all, I'd like to give Carla all the credit in the world for organizing this effort, bringing all these people together from various areas of expertise, from farming, from food to biomedical sciences. My background is MD, physician scientist. I understand the laboratory side of things. I was very fortunate to be working at Mosaic Diagnostics and convinced the company to help support on the lab side of things, but obviously there are other labs as well that have been very generous in that regard. And Carla's really brought together an outstanding series of scientists and clinicians. We have a fantastic database already from the Pearl study, which is still evolving. We don't even have all the data. But the really exciting thing is good food and behavioral interventions to pay attention to what you're eating and drinking is practically demonstrating that young people with autism can have improved behavioral outcomes in terms of their biomarkers. We're clearly seeing things improving. And as Carla pointed out, those who have chronic disease, particularly autism, which is such a devastating condition, there's a lot of other things that are contributing to the illnesses. So, first of all, there's genetic susceptibility. Secondly, there's huge numbers of toxic exposures, both mold exposures, mold toxins, as well as chemical toxicants in the environment. So that's the bad news, but the good news is we can identify those and we can help bring people back to health. So give Carla credit for this incredible job she's done bringing this group together.
There's a lot of brain power that's come to this table. The other distinction that I think y'all should just know about is that when we approached lab and diagnostics, we asked them for their sponsorship. And Lori Veris was with me at that professional meeting, and they asked what else we wanted. And I say this with a smile for every single lab that we interacted with. We asked them to join us. We asked them to be our partners. We knew that we were going to have a lot of data and that we couldn't possibly be managing it all ourselves. I think that is also a distinction because a lot of times when you go to industry and ask for help, we're asking for money. We didn't do the money ask. We did the be our partners and help to demonstrate what's going on underneath. And that has been a lesson and a lot of lessons learned for everybody. People are introducing themselves at professional meetings, and one specialist is really savvy about the gut microbiome, for example, and several of them are adept at functional genomics and gene expression. So there's like learning going back and forth, and they won't only just be thanked on our papers, they'll be authors on our papers. And we're demonstrating that we know how to build a team and keep the team together. And I think that's unusual, but we're proud of it and we're proud around the circle, which brings us to our next conversation. We're working on it now. I'm from New York. I moved into the Midwest and I've been here for a while. And it's so impressive to understand our neighbors and what people are up to and what they take on. In Iowa, it's central. And what is happening there with food, Iowa Food Coalition, the different nonprofits that are established, they started from scratch. They're looking at growing and improving food systems. And again, they are impressively, convergently, collaboratively working together. So we're approaching and interacting to see about partnering with our farmers and our neighbors so that we can lend each other expertise from Iowa Farmers Union, Practical Farmers, the coalition. And we felt like we start in the Midwest, and then what we could do is demonstrate and then move to the possibility of the coasts. And that's a little different than the way other people do it. So just wanted to point out our distinctions. And then our next program has to do with farming. So I'd like to turn it over to Dr. Michael McNeil.
I'd like to start with the thought that human health really starts with soil health. We've seen a degradation of our soil health over the past decade or two, and it appears to be getting worse. And I'd have to say the same thing about human health. Here in the U.S., we're not improving it a great deal. We've seen some major breakthroughs in medical advancements, but we need to get to the root cause. And the root cause is we're not producing nutrient-dense foods that allow our bodies to thrive. I have been working hard, along with others, in developing a science-driven regenerative organic farming systems that work well both economically and environmentally. It's a win-win situation. It's allowing the farmers to enjoy more profit and enjoy a better lifestyle, as well as improving their soil health and providing a much better quality food for us to improve our human health. One of the things when I'm working with my growers that are using these types of farming systems, I tell them, when your neighbor asks you, well, how much rain did you get? I want your answer to be all of it. We're not getting any runoff. Moisture is going into our soil. We're not creating erosion issues. Organic farming in general has had some bad connotations with it, and that we've seen some severe wind erosion and water erosion, but it doesn't have to be that way. When I use what I'm calling a regenerative organic system, it works extremely well. And we've been seeing some unbelievably good yields. I've seen corn yields approaching the 300 bushel the acre mark in organic fields, which is very remarkable.
I think you harvested this the day after we were there, and you texted me that it was 279 bushel corn.
288. It actually was 288.
Yeah.
That always makes a farmer smile. Eating well requires us to have nutritious, good tasting food. How do we get that? We're looking at teaching people to ask for nutrient dense foods. And when they do that, okay, where do I go to get that? And so we've started a pilot project. It's called Nourish on Wheels. We have a 48-foot semi-trailer that is going to contain nutrient dense organic foods. It's going to travel to small communities in Kossuth County, Iowa. I think we have 13 communities that we can visit. Hopefully get there once every other week and provide a high quality, nutrient dense food and make it available to the people there. So you have not only the convenience, but also introduction to good tasting, nutritious foods. This is being designed to prove the concept that you can improve human health. Nourish on Wheels is developed through partnerships with local farms. We're getting our food from local as much as possible. We're working with local healthcare providers and other community organizations to be sure that we're getting high quality food. We're looking at very new instrumentation to test it, to make sure it is nutrient dense, giving people the power to make informed choices about the food that they eat. Okay, so where are we going next? One of the things that I'd like to see is what we're calling Transformational Agriculture and Health Initiative, TAHI, where we start teaching and training and providing new knowledge and getting the word out, if you will, starting with farmers and others in the community that are interested. We're doing this through classroom presentations as well as carrying that to the field. So this is the new, I'm calling it precise ag, based on a convergent emerging research with a very scientific approach. Let science be our driver to prove that what we're saying works.
So the question is, would you like to help?
We're going to need a lot of help to pull this all off. We've had a lot of help, and it's been really fun working together with everyone. It's been unbelievably inspiring to see the interest that's developed and the volunteer work that has helped make us what we are today. And we've done it in a very short period of time. Think about what you've heard today and where do you fit? Is there a place that you'd like to volunteer some help, some time? We can also use financial contributions. You can serve on a committee. There are a lot of ways that you can help us. We'd really like to have you. I think you'd find that when you start working with a group, there's a lot of really fun, good people to work with, and they just keep sharing ideas, and that creates even newer ideas. Think seriously about joining us, and if you can make a financial contribution, that would really help because we are new and getting started. We want you and your time, your talent, and your brain power to help us move this along.